Health savings accounts, also called HSAs, and flexible spending accounts, also known as FSAs, are great tools for helping you save on medical expenses and can only be elected once a year during your open enrollment period. You usually cannot have both an FSA and HSA in the same plan year, so it is best to look at the benefits of each plan and see which would work best for you. When considering whether you should enroll in an FSA or HSA, ask yourself, how much do you plan to spend on medical expenses for yourself and your dependents? Do you want to use your money within a set period, or want to invest your funds and allow them to grow over time? Are you willing to enroll in a high-deductible health plan, also known as an HDHP? Here are a few reasons why you may want to choose one or the other. A flexible spending account is a special account that allows you to set aside money to pay for certain out-of-pocket medical expenses. Funds contributed to FSAs are pre-tax and lower your total taxable income, but you need to make sure that you are using the funds for approved medical expenses. When you use your FSA, you will have to submit your medical claims to your FSA administrator. They will then review the claim and reimburse you for the expense. If you decide to elect an FSA, your employer will provide more instruction of how to use it. Some administrators provide a debit card that can be used for medical expenses. FSAs have an annual limit that is put out by the Internal Revenue Service every year. Any unused funds in your FSA will be lost if they are not used within your plan year and in accordance with your plan details. Your employer may sometimes provide a grace period of additional time to use your FSA funds, but it is important to check and see if that is the case with your plan. It is not required for employers to offer grace periods or carryovers on FSAs. You may use your FSA to pay for certain medical and dental expenses not covered by insurance or for other medical needs such as prescriptions, over-the-counter medications, medical equipment such as bandages, crutches, blood test kits, etc. Some companies even offer FSAs for dependent care that can be used to pay for childcare. Again, it is important to check with your provider to see what qualifies as an FSA expense. A health savings account is another tool that lets you set aside money on a pre-tax basis to pay for qualified medical expenses. The IRS also sets a contribution limit for HSAs that can change every year. By using pre-tax dollars in a health savings account to pay for deductibles, co-payments, co-insurance, and some other expenses, you may be able to lower your overall healthcare costs. Usually, HSA funds may not be used to pay premiums. While you can use the funds in an HSA at any time to pay for qualified medical expenses, you may contribute to an HSA only if you have a qualified high-deductible health plan. A major difference between FSAs and HSAs is that HSA funds can be invested and rolled over year to year, and the balance can continue to grow tax-free. Your employer can contribute toward your HSA like a 401k plan. This can help you offset the cost of the high-deductible health plan, or it can be saved for future expenses. The total combined employer and employee contributions to an employee's HSA cannot exceed the annual limit set by the IRS. There are many healthcare expenses that can be covered by FSAs and HSAs. Some examples include co-pays for prescriptions and office visits, crutches, dental care, flu shots, hearing aids, prescription medications, vision care, wheelchairs, x-rays, annual exams, baby and children's products such as ointment, breast pumps and pads, Pedialyte, etc., various emergency medical expenses, and so much more. Both FSAs and HSAs are great tools to use if you are looking to use pre-tax money to pay for medical expenses. To research more about FSAs and HSAs, visit healthcare.gov, a government website dedicated to answering healthcare questions. You may also want to contact your employer or review your benefits guide to make an informed decision when selecting a health savings plan.